Good afternoon. Welcome to the Reichart Family Caregiver Center monthly webinar. We are so excited to have you today. How is everyone doing today?
Okay.
Good. So I'm so excited today to introduce you to Mike Mclaren, and he is logging on. Oh, he's logged on. Hi, Michael.
Hello, Casey.
So Michael and I met through a shared peer who used to work in a similar field and was very helpful to me when I started working at the hospital. And I had families that had so many questions about senior living and placement. So when she introduced me to Michael and we were putting together the webinar series, I knew I would have to save one for him because I think it's just such valuable information. So he's going to talk for a little and then we will do some Q&A towards the end. So without further ado, Michael, I'm going to turn it over to you.
Thank you. Can I be the host so I can show my PowerPoint?
I muted myself already. You can show your PowerPoint. You don't have to be the host. You just have to hit share screen.
Okay.
And if everyone could just mute during the presentation, that would be helpful.
Great. So is this visible, everybody?
Yes.
Super. So hi, I'm Mike Mclaren. My service is called Assisted Living Locators of Long Island. My work is helping people search through the 90 some options on Long Island for assisted living, memory care, and independent living, and pick out 2 or 3 that seem like good fits, go tour them with me, and determine if that sort of institutional life is good. We'll talk a little bit about what it's like inside assisted living and memory care communities. I'll talk a little bit about independent living, which is a good option for some people. But I want to be open for questions. So I have 14 slides, and I'll go through them slowly. And if there are questions, just stop, and we'll stay on the slide until we get done. Sound good? Okay. So support for seniors with just the general infirmities that come through age, or more specific infirmities like Parkinson's or Alzheimer's. They have many options for supportive services. Senior centers are in most communities, and they have a surprising number of programs, both for seniors who want companionship, a little physical activity, good lunch, and many of them also have services for people who have dementia. And it can serve, these services can serve as a day program for adults. And I know of several people who use it to provide companionship and some care for their parents, and they work for several hours a day. So it's not designed as senior sitting, but for some people, it can provide services to seniors and also a ready break for them too, as they continue their professional and personal life. And those are their day programs. And so there are also some commercial day programs. So Long Island Alzheimer Support Center and others have day programs for people specifically with dementia. And there's a cost to them, typically not too expensive. And they can be 7 hours. So sometimes adult children can use those services again to help the parents and also to give themselves a break and either do personal tasks or go about their professional lives. There are 55 plus buildings that have clubhouses. I don't really deal with them. The people I deal with are a little more advanced, but there are, of course, 55 plus buildings that can provide some services. They do the exterior maintenance, they do yard work, they can bring packages in, they can do some interior maintenance also. But here's where I start to get involved. So home care can be companionship, it can be personal care, it can be housekeeping, cooking, cleaning, that sort of thing. It can be all 3 of those things. But home care can be delivered both through private companies like Caring People and others that you might have heard of, and also can be delivered in some cases through Medicaid. And there has to be some need, some significant personal care need, but it can be delivered through Medicaid also. On Long Island, there are about 80 assisted living facilities. 10 of them take Medicaid. Not all the Medicaid facilities are that great, but several are. One in Smithtown in particular is very nice. Assisted living has no kitchen facility, so it serves all meals in common. And assisted living facilities also have nurses and aides in the building that can provide care, personal care activities like bathing, dressing. Some people can get everything done, just can't get over to tie their shoes. And it's the smallest thing assisted living communities can do, but they can do a lot more. People can be, in some of these communities in wheelchairs, need help getting out of bed, need help with a lot of activities of daily living, and assisted living communities can help with that. Memory care communities, it's a kind of assisted living program designed specifically for people with dementia and other, dementia can take many forms, but many times people with dementia, Alzheimer's, for example, frontal temporal dementia, other kinds of dementia, they also have problems with their body because the brain controls the body. The brain is starting to degrade a little bit. Then the person's ability to control their legs, their bladder, other parts of the body, speech is affected too. So memory care is assisted living with the additional complexity of helping people have safe and comfortable days who have some form of dementia. And then when people, and sometimes they do, they outgrow the capabilities of assisted living facilities to help them. They end up in skilled nursing facilities. And some of the care that's delivered in assisted living facilities is the same. They have licensed professionals, though, like nurses and respiratory therapists, so they can provide an additional level of care. And one good thing about nursing facilities is almost all of them take Medicaid. So the Medicaid options in assisted living are for people who are pretty healthy, pretty together. And there are only 10 of them, and not all are that nice. On the other hand, for skilled nursing facilities, almost all skilled nursing facilities take Medicaid. The majority of people in skilled nursing facilities are using Medicaid. They've worked with the lawyer if they have assets, to shelter them in various ways. So Medicaid is good for assisted living. It's sort of marginal, frankly, for assisted living, and it does not cover memory care. So people with dementia can't go to a memory care facility or memory care section of assisted living. New York State Medicaid just doesn't pay for that. So before I go on, are there any questions? There's a lot of information there. No? Okay. Yeah, go ahead. Hi, Gladys.
Hi. Oh, yeah. I used to work in a nursing home, and I know that Medicare only pays for 3 months. Now, how do you hide your assets? Not that we have much, but my situation is that I have a son with autism, and I'm a senior. But I'm very fortunate and blessed that he is verbal and can work a little bit with some assistance. And he's adorable. So I'm in an unusual situation here. I mean, I was a nurse, so I could take care of my almost 80-year-old husband, I think. I think. I got a bad knee. I got an osteoporosis. Well, anyway, yes. Our house is in a trust. And I don't even think we qualify for Medicaid. And we're not wealthy, but do you have any recommendation?
I do. Let me talk about that. So Medicaid is important. And some people who are generally poor, they get Medicaid sort of organically. And the limits for monthly income are $960 a month, I believe, for income. And the asset limit, not including a house, which doesn't count, is about $16,900 this year. So if you're below those two things, you can get Medicaid sort of organically. Assets that are in a proper trust, a Medicaid trust, don't count against you. Houses don't count against you ever, because Medicaid doesn't want to throw people out of their houses. But some people don't quite qualify for Medicaid because, say, their income is too high or their asset level is too high. They might have $50,000 in the bank, which would disqualify them. However, working with a good attorney or a Medicaid specialist, there are people who aren't attorneys but are Medicaid specialists who can help you work through both those issues. The income can be brought down below 960 by using a pooled income trust, which is a very common strategy. And a pooled income trust, it's still your money. Let's say you had $1,200 a month in Social Security benefits, and the limit was 960. It's different for a married couple, of course, but I'll deal with the single because it's easier to explain. So you could put the extra $300 and some into a pooled income trust. Medicaid would now see your income below the limit, and you qualify from an income standpoint for Medicaid. That money would still be available to you for rent, heat, light, essential activities that support you. So you just have to work with a pooled income trust company, and that's very easy to set up. Either a lawyer could set that up, or I've seen people do it on their own. Income is one of the two qualifiers for Medicaid, two standards for Medicaid. The other is assets. So what counts in Medicaid is cash type assets. So annuities, stocks, cash itself in a savings account. And the married number escapes me, but I know the single number is about 16,900. If your assets are above 16,900, you don't qualify for Medicaid. However, many people who are quite well off qualify for Medicaid because they work with either a Medicaid specialist or an attorney, and they get their assets lowered down sort of artificially using Medicaid trust and other strategies. They get it lowered down to below the 16,900 level, so they can qualify in the asset level too. So the answer is middle class people can absolutely get Medicaid. It just takes a little more work than if you're completely poor.
What if you want to stay in your home and you need help? Like a great CNA. And
So Gladys, I'm going to interrupt there. That's something I can go over with you after the webinar. I want to keep this one focused on senior housing. But yes, you and I can discuss that because there are many options for that through Medicaid as well.
Okay.
So I'll make sure I get you all that information. It's a great question though.
Thanks, Casey. Yeah, there's hope, Gladys. There's hope. Hope. So private commercial assisted living, you've seen these from the highway, the Bristol, Sunrise, Atria. There's a bunch of others that are not affiliated. Although Bristol, Sunrise, and Atria are the big three on Long Island. They have about 50 facilities between them, and they are and there's about 80. So they have 60% between those three brands. All good brands, a little bit different. Just gonna. There. So private, you see the private commercial assisted living is about 75. There's 7 that are mainly Medicaid, a few more on the outskirts in Queens that accept Medicaid. Independent living, there's 6, and there's 5 memory care only facilities, 5 facilities that are built just for seniors with dementia. So the total memory care programs is about 55. There's 2,000 beds. They're mostly full. They typically are mostly full. They went down during COVID, but now the 1,500, 2,000 beds that are specifically for people with memory problems, they're only about 10% open beds. When I say beds, just a convenient way to talk about spaces. These are nice facilities. They have plenty of space to walk around, plenty of activity rooms. Most have gardens that are secure. So beds is just a way of talking about the number of people that can be accommodated. Total assisted living, there's about 10,000. They're at 80% on Long Island, but there's many more assisted living beds and spaces than there are for memory care. Long Island population is almost 3 million. There are about 137,000 people who are above 75 and an additional 68,000 people who are above 85. So you see there are 12,000 beds roughly for seniors who need this significant level of support, and almost 200,000 people who are in the age group that's most likely to need it. So they're always building more. There's always a need for more. And last thing I want to mention is most people retire where they live. And we've all heard about people who retired. We all know people who retired to Florida, Arizona, North Carolina is increasingly popular. But the great majority of people, 90% plus, they retire in the area they live. Now, sometimes they move around to be nearer to their kids, or the kids move nearer to them. But fundamentally, it's a matter of for most of us, where in the area that we've lived most of our lives, we're going to retire. It's not a matter of, gosh, are we going to go cross country? Because most people don't. So we have the resources we have. We have 200,000 seniors who are likely to need these services or something like these services. And we have about 12,000 beds. Gladys, you mentioned home care earlier. Medicaid can provide home care under certain circumstances, and you have to need it, have to qualify for it. Private home care is also available. It's about $30 to $35 an hour on Long Island. It's closer to 35 now than 30. Medicaid assisted living is available. It's not free. The care is free. You pay $1,313 per month for room and board and Medicaid assisted living. It's typically, it comes out of your Social Security payment. If your Social Security payment isn't high enough, then the community gets it grossed up using supplementary Social Security income and gives you back $200 as mad money to spend. But the room and board is on the resident to pay for, and then the care is paid for by Medicaid. Private assisted living at Sunrise, Atria, Bright Star, other places like that can be as little as $5,000 a month. It's usually closer to $7,000 or $8,000 a month, and it can be more. I placed somebody with really significant needs recently at a place, and her rent was about $6,800 a month for a nice studio, and her care was almost as much. Her care was $5,700 because she needed a lot of attention. So private assisted living, some people just live there without care, and some people need a lot of care, and most assisted living places can stretch quite a bit. Private memory care, probably aren't too many places that are under $7,500 at this point. There are a couple of places that are more custodial than anything else, but fundamentally, private memory care is on Long Island is in the $8,800 to $10,000 a month range. But interestingly, that's all inclusive. So when you're in memory care, in most places, you pay one fee and that's it. Any questions? Okay. So the considerations for assisted living, and this would apply for independent living and for memory care. The considerations are location. Now, a lot of people think that's location near where the senior lived, and the most sensible way is to arrange it near where the visitors might live. So if the senior lives in Queens, but all the family's in Nassau, you want the family to visit, you're probably not leaving the assisted living community, every day. You can certainly get out and go on trips, but you want to be close to family, so it's easier for family to visit. So location, and by location, I mean close to family, is important. The services offered are important. Some people need almost no services. My mother-in-law lived in a Bristol for over 2 years before she needed any care, any assistance from the aides or nurses there. But now that she has some needs. She's not walking very well, and she's going to get assistance in showering and a couple other activities, and the care is there. So when we talk about services too, we talk about care now and care in 24 months. So I call this reserve capacity. The community you choose should have the ability to care for you in 24 months based on things we can reasonably anticipate. So, for example, we know the kind of dementia the person has. We can reasonably anticipate when physical problems like walking might start to become part of the person's life. It's not a perfect science at all, but if you've seen seniors, I've seen hundreds and hundreds of seniors, and I kind of know one osteoporosis, severe osteoporosis, might put a person in a wheelchair, for example, where in the timeline of most people's lives, they might end up needing a wheelchair. Or when a person who has dementia might also develop physical problems. So we're not geniuses. We can't predict more than 24 months in the future. And we have to be humble and admit that sometimes we can't even predict that 24 months. But within the best of our abilities, we try to plan out for 24 months and make sure the place we choose can also be helpful in 24 months. The environment is important. Some have a reasonable slate activity, some have an awful lot, 10 or 12 things a day. So check out the activity schedule, check out the religious services. Many have religious services that come into the building or take people outside the building for religious services. They'll feed you a lunch, so you can check their food out. And of course, always ask for a tour when considering a place. Assisted living is typically billed as rent plus care. So rent is room and board, and you pick out the apartment you like. And if it's a very modest place, it might be a single room. It might even have a roommate. Other places have 2-bedroom suites that are really beautiful. So you pick out the kind of room you want, and then the care costs are added on. And sometimes there's no care cost because the person's very, very able. And sometimes the care is included. So
Mike, we have a question. How variable are these costs over time? Like, is there an estimated increase for the care each year, a percentage?
I would anticipate in this inflationary environment to figure on 5%, and you'll be pretty close. And that's on rent. The care cost typically doesn't change that much, but it's the rent. So let's say you had a 1-bedroom apartment in a nice Bristol. The rent might be $7,500. So you can anticipate the second year there, your second year, on your anniversary, your rent would go up about 5%. So that would be $375 per month, excuse me.
Thank you.
So
I'm sorry, we have a follow-up. How does such charge if you look at Queens versus Long Island? Point to any other New York City resources.
So I'm not sure I understand the second part of that question. Point to any of the New York City resources. What do you mean by that?
Risha, can you clarify that? But is there, for the first part, is there a difference in the cost of Long Island versus Queens?
I can't. It's my question. I actually used the word sitch. The question was, how does the situation change and how does it look differently? Because you brought up a good point in terms of you'd think that you would find something, where the senior lives, but I live in Queens. So I never even really thought about looking into what that might look like. So how do we do that comparison? What is it? What do you know, just off the top of your head? And then what are the resources, that I could look to get this kind of, the same kind of information that you're sharing about Long Island? How could I get that about Queens or, the 5 boroughs? Thank you.
Sure. So Queens is an odd place. There are far more assisted living communities in one corner of Nassau County than in all of Queens. So my familiarity extends just to Eastern Queens, just to the part closest to Nassau. And really there are 3 Medicaid communities and 2 private communities in Eastern Nassau. And that's about it. Perhaps as the land is more available in Nassau. I'm not sure exactly what it is, but the assisted living in the situation in Queens and Brooklyn too, on a private basis, is not that great. It really isn't. And they're building a few more in Manhattan, but they're very expensive. They're much more expensive than places on Long Island. If you're in Queens, there are 2, one in Kew Gardens and one in Forest Hills, both atrias, both nice enough. The atria in Kew Gardens can handle a little more complex patient. The one in Forest Hills is really designed it's an apartment with services. That's kind of what it is. So people with really significant difficulties would not end up there. But socially, it's nice. It's very nice. Does that answer your question, Risa?
That was Michael. Yes. Thank you.
And who do you get information? For me, I'd be glad to help you understand what your options are. And if we were talking, first of all, I never charge anything. So all my charges go to the assisted living committees themselves. So you can talk to me all you want for free, but I'd help you, if you'd like, pick out 2 or 3 places that might be appropriate, give you some basic information, then we could go from there. But I'm always free. So I'll tell you my story real quickly, how I started this work. We promised my parents that they could live out their lives at home. My sister and her husband even sold their house. My parents sold their house and they bought a house together. So they really planned on this home life, and it worked out well for my father. He died very peacefully at home, but my mother's Parkinson's really accelerated once he passed away. She ended up doing the laundry in the oven, and she was dangerous, dangerous to everybody in the house, including herself. So we had to find a place for her to live. And we were rushed. The doctor said, you got to do it today. It was a whole unnecessary panic situation. So we found a place, and she never really settled there. Now, I don't think the place was bad. It wasn't great, but it was just quickly chosen. So I just resolved that at some point in my life, maybe I could help a cousin, for example, with a parent. I could have one person just make a more discerning, a slower decision, a more careful decision. And as my corporate career sort of wound down, I realized I could do that work as a job, right? So I could start a business and help people on a regular basis. So that's how I got into this business. And I think of my mom, especially when I place people with dementia. I think of how she never got settled, and I want families to have a different experience. So this is what I do, and this I'm a placement specialist, and there are actually, there are a lot of people. There's about 25,000 people across the country who do this work. You just never know it until you have a need for it. But my work is around assisted living, memory care, and independent living, which is sort of like assisted living. You get a kitchen. The state trusts you with a kitchen, so you have hot surfaces, but there's no nurse in the building. So you can bring in aides. Aides can be found and be brought in, and some people live in independent living quite successfully, even with some significant difficulties and needs. There are only a handful of independent living facilities, so most people, they choose assisted living because they don't need the services now. They're going to need them in a year or so. So they choose that. And memory care, most assisted living places also have a memory care section within the building. And there are some freestanding memory care places. Artis is one, which is in Comac. Bristol has one. There's a all kosher one now called the Esplanade in Woodmere, and there are a couple others. So I want to cover the same ground twice, but I'll talk about these fairly quickly. Assisted living is supportive living for seniors online. So it's apartment living with activities, with social activities, with doctors who make calls on the building, who have daily times when they're there for appointments. And the assisted part of it, assisted living, is assistance with the activities of daily living, things we all do. So they're going to cook for you. You don't have to do that. They're going to shop for you. You don't have to do that. Personal care activities, bathing, dressing, toileting, those services are all available if you need them. If you don't, just, they're going to clean, they're going to cook, they're going to do your laundry, and just enjoy the social activities. And it's always, in assisted living, there's always a nurse available. Questions, anybody? Okay. Memory care is assisted living, so it provides the same physical support for people who have dementia. So when you communicate with people with dementia, there are particular techniques you use. You redirect them. So for example, if they say, hey, I want to go out to the malt shop that they lived next door to 50 years ago. So tell me about that lot. This is how you redirect it. Tell me about that malt shop. That sounds really good. I want to hear all about what ice cream you like. And you listen to them, you honor where they're at in their mind. They're not here. They're 50 years ago. Yeah, that's great. That's great. Hey, did you know we have ice cream here? Yeah, come on over. Let's try our ice cream here. And usually that's enough to get people back into the flow of what's happening there in the memory care unit. And they aren't disturbed by the fact that they aren't going out to the malt shop that they went to 50 years ago. So redirection is one of the techniques that is commonly taught. and it's used by every assisted living facility every day, and there are others too. So you have the physical care, support for activities of daily living, but you also have the kind of interaction techniques that make people who have dementia, feel respected, like people. Their reality is as important as our reality to them, and then they're redirected. And there's some other techniques used to calm people too. Any questions? So you guys probably know that dementia is caused by a number of different processes in the brain. Alzheimer's is about 60%, but there are many others. Frontal temporal is an example of something that typically strikes people a little earlier in life. So early onset dementia is usually frontal temporal. It's the front part of the brain. People can have vascular dementia, where the arteries that serve the brain are no longer functioning at peak performance. So part of the brain dies off because it doesn't get blood. There are other kinds of dementia. The underlying cause of the dementia, though, isn't that critical, because when people have memory problems, when they have decision-making problems, when they can't stay in the present, it sort of doesn't matter to the staff at the memory care facility why it's happening. It matters to us because we want to understand what the timeline is. The timeline for Alzheimer's, for example, is very different than the timeline for frontal temporal. We want to know that so we can kind of be prepared and place people at the right facilities so that they aren't immediately sort of out of the facility because they can't care for them. So we understand why, but on a day-to-day basis, it's not that important. There are psychosis that have to be dealt with. Often when people have dementia, they also have paranoia, or they have depression, or they have anxiety. And those can be, sometimes we can manage those a bit. We can't stop the slide of dementia. It's sort of unrelenting. But on some of these psychiatric problems that accompany dementia, we can sometimes intervene and give people different kinds of drugs to help with their anxiety, sometimes help with OCD, sometimes help with even schizophrenia. So that these peripheral things that are important can sometimes be managed to a certain degree. Any questions? No? Okay. So this is what I talk about.
I have one question from Michael. If you are paid by the facility, how can you make a neutral recommendation?
Well, I'm paid by all the facilities. So they all pay about the same. So I make recommendations from among the people who are paying me. So it's not like one place pays and the other place doesn't. Fortunately, on Long Island, it's virtually everybody pays. So I don't want to charge clients. Some of my competitors do in some circumstances charge clients. I don't want to do that ever. So I have to make a living. And it's fortunate that I don't have to decide based on my pocketbook where to put people. I decide based on my experience with facilities where I've had families that go there who have been successful, but they're all going to pay. I function sort of like a highly specialized real estate agent, and I can take people to different kinds of real estate developments, and the money is all the same for me. So it becomes neutral, actually. Michael, is that a good answer? That's sufficient? Okay. Hi. Is that good, Michael? Okay. We're having trouble getting an answer, but just jump in anytime, guys.
Do you make what you are getting from the facilities transparent?
Is that a question or a statement? You got to cut out at the beginning.
It was a question. So you said they pretty much all pay the same. If they do not pay the same, are you able to disclose the delta?
Well, I would if it came down to it. No one's ever asked me that. And the difference is literally just a few percent. So it's the delta is very small. And I would much rather have a person, to the extent there is a difference, I want somebody to be comfortable and be happy and recommend my services, frankly. So if I choose a place that isn't that great and they have a bad experience, then the word of mouth that all small business people look for will be ruined. So I'm happy to take the smaller percentage for the happier person. But in general, I don't have to make that decision because they're all about the same.
Thank you.
Thank you. So
We have one question in the chat. How do you know when it's time to make the move? What if one parent wants to stay in the home and the other one wants to leave?
Well, they can, some people do split up, and happens not with assisted living, it happens more with memory care, where one person's memory has become so bad that they need support. And one 85-year-old person can't really care for a highly needy 85 person, another 85-year-old person. So sometimes it's they do split up. Sometimes they go together. But I deal mostly with single people. That's 90% of my population. So it's widows, widowers, divorced people. And I'll tell you that the main guideline that I use when the care for the person is affecting multiple generations, it's time to consider finding other ways to support the senior. So we all know that for our spouse, we're sort of in it, right? So we're gonna, at 85, we're gonna do our very best to care for our spouse at our generation. Sometimes children are drawn into care for their parents, and to some extent they can manage it. Other times it becomes overwhelming. But when it starts to draw in grandchildren, and grandchildren aren't getting attention, spouses of children aren't getting attention, then you have to consider the impact on the whole family. So when is it time? Couples are, an issue when one desperately wants to leave and the other one desperately doesn't. Sometimes home care is good for a short term, just to help out the person who needs more care. But whether it's a single or couple, my rule is how much is the needs of the senior affecting the whole family, and we have to be respectful of. We have to put in time for our family, and we also have to be respectful about drawing just so much time that the grandkids can't do their activities, or the people consistently miss, the children consistently miss vacation, or the children have to contribute more and more money to care that might be taken care of if they went into a community. So I consider kind of the overall impact of the family, but especially when it gets to multiple generations, I would say, maybe it's time to consider something like this. So I talked before about reserve capacity, and I'm an advisor, right? So this is one of the most important things that I do. Families at my company and say, hey, mom is in pretty good shape now. She needs some help kind of getting going in the morning. I stand by her during the shower, but that's about it. Okay. So what's the underlying condition? The underlying condition may be nothing. She may be a very healthy person. On the other hand, the underlying condition might be congestive heart failure, where 5 minutes of activity exhausts the person. It might be osteoporosis, where that their ability to manipulate the hands, to walk is going to be worse and worse. It might be dementia, and it might be just a happy sort of kind of understand the world, but not really, but not that bad at this point. So what's it going to be like in 2 years? Based on the doctor's recommendation and doctor's thought, my experience, the experience of the people at the communities, we try to anticipate what it's going to be like for that senior in 2 years. And we want to have enough of reserve capacity in the facility we've chosen so that in 2 years, it's very likely a person is still going to be well cared for there. And I can help in a lot of things, help find facilities that seem friendly and upbeat and match the person's current needs. But this is the real art to placement. It's making sure reserve capacity, as best as we can plan, can also care for the person 24 months out. Any questions, guys? Okay. So I'll give you an example. I was at a community yesterday where I'm working to place a woman, and we went into the memory care section, and later on the community person said, do you remember the person sitting at the spot? And I said, yes. Well, she's been here 15 years and she came here with dementia, but walking, talking, healthy. Now she's in a wheelchair. She needs significant help with all activities of daily living, but 15 years later, she's in the same facility. So the reserve capacity of that community to care for that woman was 15 years and very significant changes. And I thought that's just a great story. She was well placed, and that community has done a great job of caring for that senior.
So Mike, I have two questions. I have one from Michael. How do you do the cost benefit analysis between having living care in the family home versus assisted living?
Well, it's more of a lifestyle than a cost benefit analysis. Home care companies, if they have a 24/7 person, they'll sometimes negotiate. So it won't be $35 an hour. It will sometimes be, less. But for 24/7 care in the home, it would typically be more than $100,000 a year. And that's about the same cost as a community. So an assisted living community, it's not one-on-one. So the aides are not one-on-one with people. On the other hand, there's a lot of activities, there's socialization, there's healthy meals, there's doctors who come on site. So it's not really a mathematical, I have a real statistical background, and this defies any ability to defies any ability to really do the analysis. The cost for round-the-clock care and assisted living are roughly the same on a private basis. They're roughly the same. So it's just a matter of, does the person need and want one-on-one care and aid looking right at them all day? Or are they, once they get dressed and ready to go, are they free to set loose in the community and make some friends? And really, it's based on the family and the person to decide.
So the second question is, I know you've discussed the reserve capacity, and there are many different types of assisted living. There's independent living, assisted living, the memory care, and some of the facilities like a Sunrise is an enhanced assisted living where they do have the capacity for more intensive care long-term.
Correct.
But are there communities on Long Island like you see in other states where they have the 3 to 4 levels within the same facility, where it's independent living to assisted to memory care or to long-term? We see that in other states. Do we have that on Long Island?
So we have a couple of different options. One is called long-term, a CCRC, a continued care retirement communities. There are 4 on Long Island. Gerwin is becoming that. I'm not sure they're quite there, but they're becoming that. So they would have assisted, independent memory, and then a nursing home. Peconic Landing, Jefferson Ferry, and the Amsterdam in Port Washington all have all 4 things. Now, those aren't monthly facilities. You do pay a monthly rent for them, but they also charge a lot to begin your stay there. So they'll charge several $100,000 to up to $1 million to begin your life there. And you get a significant percentage of that back when you leave, because you want to leave or because you passed away. But those are the only 4 places on the land that have this approach, this CCRC approach. Brightview in Sayville has 3 of the 4. They have really nice independent living section of the building. They have memory care, and they have assisted living. They don't have a nursing home. So the nursing home is what's not connected in New York State. Now, in other states, it's very common to have nursing homes built into the complexity. I visited a relative in Connecticut, and the nursing home, it wasn't a buy-in like it is here on Long Island. It was just simply monthly rent, but they had all 4 options on their campus. So New York State has a little bit different regulations, and that leads them into a different process. Independent living places, by and large, are separate from assisted and memory. So assisted and memory go together, and independent, by and large, there aren't that many of them, but by and large, they're freestanding buildings. And then the CCRCs are out there, and they're quite costly.
Thank you.
Okay. So Medicaid funded assisted living. Medicaid funded assisted living was instituted by the state of New York to take pressure off nursing homes, and specifically off nursing home capacity and cost. So when you go into a nursing home, you're paid for by Medicaid, which most people are, even people who are well off. It costs the state $15,000 a month. about. When you go into assisted living, it costs the state $5,000 a month. So the state wants to encourage these Medicaid funded assisted living places because they save $10,000 a month. And these Medicaid assisted living, funded assisted living places, they have a fairly narrow audience. Can't be in a wheelchair, you can't have dementia, you have to be able to feed yourself. So they want the best, I guess, the most capable people. So Medicaid funded assisted living is modest. You typically share a room. There are some activities. The food is okay, but it's not like a Bristol or a Sunrise. You know, it's designed for people who need some help but not too much. The Goldilocks sort of theory. If you've looked around, you've probably seen Amber Court. There's Braemar and Medford. There's some others that accept Medicaid. And if you need assistance but not too much, and you have Medicaid, these can be good places. But these are not places for people with a lot of needs. Questions, guys? Okay. Independent living, they're apartments, and they're just regular standard apartments. And they provide services like laundry and dry cleaning. There's no home care staff. There's no medical staff. However, most of them have made arrangements with the home care company, so they can come in and just help you privately, and you pay them directly. There are about 10 independent living communities, and you have a kitchen. So that's one of the big differences. You have activities, you get fed a varying number of meals based on the place. Sometimes it's 2, sometimes it's 3 meals a day. And the cost can be a little bit less than assisted, not so much less, but a little bit less. So in the same community, for example, in Yaphank, Chelsea has independent living in one building, and they have assisted in the very next building. And the cost difference is probably about $1,000 a month for equivalent apartments. So when we think about dementia, you know, the things that I talk about with the family, we understand the specific cause of dementia. You know, saying old age dementia, it's not right, and it doesn't help us understand it, because I've met a lot of 90-year-olds who don't have any problems with their mind. Their mind is as sharp as a tack. So dementia is caused by specific problems within the brain. It's not caused by old age at all. That's kind of a fallacy that people thought about. Certainly there's a problem, but it's not because of the number of years that person's lived. Different kinds of dementia have different progression. We can often tell when the person's going to develop problems with their legs, for example, or their speech, ability to swallow. And we want to understand that, so we place the person in the right place. We use a 24-month plan, and remember, dementia, it affects the whole body. So if your mind isn't right, then you can't control your legs, you can't control your speech. So it all begins in the mind. Every action begins with a thought. The steps to get into assisted living are really, it can happen. I place people who had to leave a rehab facility. I place people in 3 or 4 days. So it's pretty quick. They want you there. Right? They want new residents. So we'll do tours, certainly if we have plans. Sometimes if we have time, sometimes we'll do just one tour. If there's really only one place that's near the family that's the right place, we'll just say, this is it. I mean, this is the best place. Everything else is going to be either not the right care, not the right cost, not the right location. But we'll do, typically, if people are interested in assisted living and memory care, we'll do 2 or 3 tours just to give people a flavor of what's out there. Once we pick one place, then the community, the facility, will do an assessment of the senior to figure out just what's going on, what kind of care they need. They'll give the family back the findings of the assessment, and from that they'll develop a care plan. The costs are determined, right? Because it's rent plus care for a lot of places, so they want to understand what the care cost is, and then the client can move in. Assisted living is required in New York State to supply a bedroom suite. Sometimes the family wants it, sometimes they only want pieces of it. If it's a larger apartment, then the family supplies the other furniture, the living room furniture, for example. But it's it's a pretty quick process. There's a doctor's visit involved. There's a tuberculosis test. There's a recent COVID test, but it's pretty easy. It's easier than renting an apartment. I remember renting an apartment. I had to bring my financials in for years. There's none of that in assisted living. Oh, that's it. Okay. I'm done, guys. So how can I help?
If you can hit stop share.
There it is. Yeah, thank you.
And then I have a few questions from the chat for you. And thank you so much for all that.
Sure, Casey.
The first question of the two is, can you explain when you have to do a buy-in versus just monthly rent?
So 4 places Long Island, CCRC, require a significant buy-in, hundreds of thousands of dollars. And in return, they offer two things. They offer a spot in any of the four types of residences they have on site. They guarantee you a spot for a nursing home, for assisted living, independent living, which you typically start in when you move these places, or memory care. So they guarantee you a spot, and they reduce the monthly rent they charge. They still charge monthly rent, but instead of $7,000, it might be $4,500. So if you move in at 70 into independent living and you have 20 years there, that reduction of monthly rent every month is pretty valuable. So the people who move into these CCRCs typically get the best value. They move in when they're 72, and they use the activities, and they have a fun time, and they progress through. And some don't even progress through. Some live and die in independent living 20 years later. So they just need a little bit of care towards the end. And I don't deal with them, by the way. So they're not part of my world. I will tell you that most of that money, 60% of it on the average, is returned at the end of the person's life. The community just uses that to fund themselves during the person's residence there. The other places that I deal with are rent plus care. It's a monthly rent. You pay an extra month up front. They call it a community fee or a move-in fee, but that's it. So if the rent is going to be $6,000, you pay the first month's rent plus an additional $6,000, and then that's it. And you can move out at any time with 30 days notice.
The second question, what are the top 5 facilities on Long Island?
Well, the ones that have the most facilities are Atria, Bristol, and Sunrise. They're national brand. Bristol is regional brand. The other two are well-respected national brands. Atria is number 2 nationally. Sunrise is number 3. And there are additional ones. Brightview has one facility. They're building a second one in Port Jeff that's almost open. All American in Quorum is very nice. It's simple, but it's very nice. I wouldn't want to say if the top 5 are, because people have different needs and they have different expectations. So people who need no care might do very well in Arbors, which is a single price, mostly single room, single price, very active. So it's a matter of what's the top 3 for that person. And it takes an hour or so of discussion to kind of figure out what they need. So Bristol, for example, my mother-in-law has had a great stay there. People who are a little further along, a little more acute, may need a Sunrise or may need a different kind of facility. So really, it's a matter of evaluating and determining what that person needs, and what's best for them is not best for the next fellow.
Debbie wrote, she apologizes she joined late. However, she was asking if you could provide your email and or phone number, so if she has questions moving forward, she could reach out to you.
I'll give it now, and you can get it also through Casey, but my email is mikem@assistedlivinglocators.com. And my phone is 516-254-9481. And that I can take a text for that too, of course. So that might be the easiest.
And like Mike said, you can always email or call the Reichert Caregiver Center. We have his resource and referral contact information. Any other questions from the group? Debbie says, thank you. Any other questions from the group about anything we discussed today, or any questions that were not addressed?
I think Barbara has a question.
Can I just talk, or do I have to type?
No, you can talk.
So a couple of things. First of all, I want to thank you for doing this, but I'm just curious, how long have you been doing this?
Since October of 2019.
since October of 2019. And if I wasn't on this Zoom call right now, how would I ever know that you existed?
Well, because you're part of the caregiver center, we would introduce you to a Michael.
You would.
Yes.
Well, I wish I knew the answer to that because I'd be there.
Yeah,
But-
yeah. No, so, I've gone through this. So I'm thrilled to know that people like you exist, because when you were talking about, making decisions in a panic, that's how I feel like all of my decisions were made.
Yeah.
And so the idea of making these like really important decisions in a little slower, little more thoughtful, would
Yeah.
be, I think, a wonderful thing. So thank you for doing this. Thank you. And thank you, Casey, for
No,
bringing
not a
it to us.
problem. This is why we really want, that goes to one of the hearts of the caregiver center. Not only is it to provide support to you because we know everything you do endure, but it's also because you don't know what you don't know. And
Yeah.
for many people, you get the education of it after the fact or when you're going through it. So being connected with a center like us, it helps you, brings you to a Michael, brings you to a long-end Alzheimer's and dementia, or a home lab, which was a hot topic in our last support group, were home labs and home visiting doctors. You don't know all of the resources that are out there, and that's why we've created our resource library. So in speaking with you, we can help connect you to these services, because it is impossible to know everything that's out there. And typically when you need it is when you're going through it. And how do you know who's reliable, who's not, what's legit, what isn't? So we want to help you and support you through that. That's why we keep such a list of every topic. So you always have options and you're always directed to the right section, as opposed to being searching on Google for 2 hours. We can give
Thank
you
you.
5 numbers and save you that time.
Hey, Casey, I'm looking through the questions and I see the question about buy-ins versus rental. And I see a little bit different, as I read the question now, I see a little bit different slant on it. It says, when do you have to do the buy-in versus just monthly rent? So it's either or, right? You can choose a facility that has a buy-in, or you can choose a similar facility that does its monthly rent. So you never have to go in either direction. You can get the same services by buying in, or you get the same services by choosing a facility that's month to month.
Thank you for that clarification.
Absolutely.
Any other questions from the group? Gladys, any questions?
Let me see.
You muted yourself, Gladys.
Can you hear me now?
Yes, we have a few moments left, so I know you had some questions earlier.
No, I just wanted to know if you're a shade above qualifying for Medicaid, what should you do?
So that's where I can connect you to some of these Medicaid liaisons, because they would be the expert at answering that, because that is all they do.
Okay, thank you.
You're welcome.
Thank you, Michael, and
Thank
thank
you,
you,
Gladys.
Casey.
Of course. We have time for one last question. Okay, well, I want to thank you all for joining. I always think it's good to have information, because we never know what decisions might come in our near future or far future. So I always think having some information's helpful. It doesn't make it as overwhelming. Risha says thank you. But Michael, thank you so much for coming on. I know you've always been a great resource to me when I worked on the floors and now in the caregiver center. So thank you so much for doing this. I'm sure we'll have you back in 2023 as well. Debbie says terrific lecture. Thank you so much. So thank you all for joining. Just to let you know, oh wait, before I go on, Michael says, knowing what you know today, where would you put your mom?
Yeah, we ended up in a long-term care facility, and I would want to examine the family's finances to see if we could afford a memory community. So we ended up in a nursing home, and there wasn't a lot of staff, there wasn't a lot of space. So if I had to do it over again, I'd see that if the family could have collectively afforded a memory care community or memory care section within an assisted living community. That's the change that we made.
Thank you.
Or upbeat.
So coming up for the Reichert Family Caregiver Center, we have many events. We are bringing back Reiki Tuesdays to the center. We are extending the time from 4 sessions to 6 sessions per week. It will start next Tuesday. So if you'd like to come in, it's about a 20 to 25-minute Reiki session. It is at no cost. Please give me a call. We'll reserve a spot for you, and it happens right here in our center. So you get to see the beautiful space that we have. Gladys is our first to sign up next week at 3 o'clock. So we're happy for that. We have our next support group on Wednesday, September 7th. You will get an email with that, along with the third part of our webinar series. I will give you a glimpse. In September, we have the town of Huntington speaking. I know they've spoken previously about their adult daycare, but they are coming on to announce that they have opened their senior center again. And it's such an incredible place and program. So we're excited to have them share about that. And then to continue on today's theme, in October, we have a woman presenting about aging in place, about being able to stay in your home and how that looks and how that works. She will also be sharing, if you are to hire a paid caregiver, like a home health aide, what are the questions you should ask? What are the things you should look for? So that should be a very interesting one in October as well. November, we have Long Island Alzheimer's and Dementia Center presenting, but their focus is on the caregiver, caring for the caregiver and your mental health. As you know, we do want to make sure that your emotional well-being is always identified and supported. And in December, being a caregiver through the holidays. So that's always a lively discussion. We had it last year. We're bringing it back this year. So again, thank you so much for joining. If there's anything you would like from the center, please don't hesitate to give us a call. You could always email me as well if there's any information. And thank you for joining us. Have a wonderful day. Please take care of yourself.
Be safe.
Thank you.
Thank you for having us.
Thank
My
you.
pleasure. Again, Michael, thank you so much.
I enjoyed it. Thank
Thank
you.
you.